Your routine urine test can look normal, while another simple test may detect a kidney problem much earlier. That test is called UACR, and it looks for a small amount of albumin, a type of protein, leaking into your urine. Finding albumin in urine does not automatically mean you have kidney disease, but persistent elevation can be an important clue worth discussing with a healthcare professional. So what exactly is UACR? UACR stands for urine albumin-to-creatinine ratio. Instead of simply asking whether protein is present, the test compares albumin with creatinine in the same urine sample. That ratio can help healthcare professionals interpret how much albumin is appearing in the urine. One reason doctors may order a UACR test is to look for signs of kidney damage that may not cause noticeable symptoms yet. This can be especially useful for people who have conditions that can increase the risk of kidney problems, such as diabetes or high blood pressure. Kidney damage can sometimes develop quietly, so testing can provide information before obvious symptoms appear. And that is one reason urine testing can be an important part of kidney health monitoring. If albumin shows up in your urine, it doesn't automatically mean your kidneys are permanently damaged. Temporary changes can sometimes happen because of things like intense exercise, illness, infection, or other short-term conditions. That is why one abnormal result may need to be repeated rather than interpreted on its own. If UACR remains elevated over time, however, it can be an important signal that deserves medical evaluation. The test itself is usually quite simple. You provide a urine sample, which is then analyzed in a laboratory. In many cases, a spot urine sample can be used, so you don't necessarily need to collect urine for an entire day. Your healthcare professional may give you specific instructions about when and how to collect the sample. And depending on your situation, your clinician may recommend repeating the test to confirm whether the result is persistent. A Burdedia result is only one part of the kidney health picture. Your healthcare professional may also consider your eGFR, blood pressure, blood glucose, medical history, and previous test results. For example, a person with a higher UACR and a reduced eGFR may need a different level of follow-up than someone with a single mildly abnormal urine result. That's why it's better to ask, what does this result mean for me, rather than trying to interpret a UACR number from a chart online. Your healthcare professional can interpret the result alongside your other tests and your individual health history. But there is one mistake many people make when they see an abnormal kidney test, and it can create unnecessary fear. An abnormal UACR result doesn't automatically mean you have chronic kidney disease. Temporary factors can affect the amount of albumin found in urine, and doctors may need repeat testing to determine whether the finding persists. The important question isn't simply whether albumin was detected once, but whether the finding is persistent and what your other kidney tests show. So if you receive an unexpected UACR result, don't diagnose yourself from the number alone. Now let's look at when a UACR result deserves closer attention. If UACR stays elevated on repeat testing, especially alongside other abnormal kidney results, it deserves closer medical follow-up. It's particularly important to discuss persistent changes if you also have diabetes, high blood pressure, or a history of kidney problems. Your clinician may decide whether the test should be repeated, whether other kidney tests are needed, or whether further evaluation is appropriate. And if you're already being monitored for kidney disease, follow the testing schedule recommended by your healthcare professional. So, what should you actually remember about this test? UACR is a urine test that measures the amount of albumin relative to creatinine in a urine sample. It can help healthcare professionals look for signs of kidney damage, especially when interpreted together with other kidney measurements. A single abnormal result doesn't necessarily mean permanent kidney damage, because temporary factors can sometimes affect the result. But if albumin remains elevated over time, it's something worth discussing with a qualified healthcare professional. And if you want to understand your kidney health better, don't just look at one number. Learn how your creatinine, eGFR, UACR, blood pressure, and medical history fit together. If you found this explanation useful, subscribe to VitalBites for simple, evidence-aware kidney health videos. This video is for educational purposes only and is not intended to diagnose or treat any medical condition. If you're concerned about your UACR or other kidney test results, please discuss them with a qualified healthcare professional.